Welcome to Care Wisconsin Provider Orientation. Care Wisconsin is committed to working collaboratively with its providers to deliver innovative, long-term, and healthcare options to help empower our members to live as independently as possible. In this orientation, we will review all aspects of Care Wisconsin. Specifically, we will help you and your staff understand the 4 programs we administer, how to work with Care Wisconsin most efficiently, review our website, and more. We provide you with an overview of the Care Wisconsin organization. We will give you a description of each of the Care Wisconsin programs, the benefits of each program, an overview of prior authorization requirements, and how to verify member eligibility. We will also provide you and your staff with vital information about working with Care Wisconsin, including our quality management program, model of care and fraud, waste, and abuse prevention program, how your organization can notify Care Wisconsin of changes to your practice, what information is available to you on our website, and important contact information. Finally, we will provide you information on the submission of claims and claim appeals. Care Wisconsin, a nonprofit managed care organization, and has been a licensed HMO in the state of Wisconsin since 2005. Care Wisconsin specialized government programs serve frail elderly and individuals with physical, intellectual, and developmental disabilities. We are a leader in creating and implementing programs that help vulnerable and underserved people live as independently as possible. Care Wisconsin currently has 4 programs, each with distinct parameters to serve individuals. Family Care helps members coordinate their long-term care needs. Family Care is aimed to provide services for adults with physical, developmental, intellectual disabilities, and frail elders. Family Care Partnership, often referred to as Partnership for short, helps members coordinate their long-term care and health needs, such as primary care, and help for chronic illnesses. Partnership is for adults with physical, developmental, intellectual disabilities, and frail elders. They must be eligible for Medicaid and meet other functional and residency requirements. Medicare benefits are included for eligible individuals. Medicaid SSI provides health care and behavioral health coordination for services from primary care and specialty doctors and community agencies. Medicaid SSI is for adults who are eligible for Medicaid SSI due to a disability determined by the Disability Determination Bureau. They must meet other income and residency requirements. Medicare Dual Advantage provides coverage for all Medicare services, Parts A and B, and prescription drug coverage under Part D, and is for adults who are eligible for both Medicaid and Medicare. In the previous slide, we provide a brief explanation of how our members become eligible for our programs. This slide gives you a picture again for the eligibility requirements for each of our programs and some of the similarities and differences. You can see first that for all of our programs, that all members must first be eligible for Medicaid. The second common component in all Care Wisconsin programs is that all members are adults. Care Wisconsin does not cover children. All programs are for adults. Family Care and Partnership is for adults age 65 or older or 18 and older with physical, intellectual, or developmental disabilities. Family Care and Partnership members must meet functional requirements, which mean that a person needs help performing other activities such as bathing, dressing, or eating. Note, the Family Care program is not currently available in Dane County. To be eligible for Medicaid SSI, a member must be an adult who has a disability as determined by the Disability Determination Bureau. Medicare Dual Advantage is available to adults who must be eligible for both Medicaid and Medicare, who live in the Care Wisconsin service area that is approved by CMS. It is important to note that members of the Family Care Program and Medicaid SSI program that have Medicare may also be eligible to join Care Wisconsin Medicare Dual Advantage. The Family Care map demonstrates our office locations. Our Family Care program is currently in 39 counties. Partnership is in 7 counties. Our Medicaid SSI program is in 30 counties, and our Medicare Dual Advantage program serves 5 counties. We currently have nearly 10,000 Care Wisconsin members. Understanding family care. Members' coverage must be verified before every encounter. Family care members are not issued a Care Wisconsin ID card. Ask to see the member's Forward Health ID card and a photo ID, then check the member's eligibility using the Forward Health online portal. The Family Care team includes the member, care manager, and a registered nurse. The member is the most important part of the team and helps define goals. The care manager learns the member's strengths and needs and matches the member to community services. The registered nurse coordinates healthcare needs with members. The team may also include any other person identified by the member as part of the care team, such as a family member or community support. The Family Care Program benefits include Medicaid long-term care services and home and community-based waiver services, which can also include residential services, respite care, medical supplies and equipment, supportive home care, and certain mental health and AODA services. Services that are not available under the Family Care Program include Medicare-covered services, acute and primary services, psychiatry services, and mental health and AODA inpatient treatment. These services are often covered under other programs and or payer sources. Family Care Program benefits are subject to prior authorization through the member's care team. Contact the member's care team for prior authorization. If you require assistance in connecting with the member's care team, please contact the Care Wisconsin Customer Service Center at 1-800-963-0035. Understanding partnership. For partnership member eligibility verification, please go to the Forward Health portal and verify that the members are currently covered under Care Wisconsin's partnership program. Partnership members are issued a Care Wisconsin ID card. Even though members are issued a Care Wisconsin ID card, please utilize Forward Health to verify eligibility. This Forward Health is the most recent and up-to-date eligibility information. Ask to see their Care Wisconsin member ID card and their Forward Health ID card and a photo ID. Again, use the Forward Health portal at each visit to verify member eligibility. The Partnership Care Team consists of an administrative assistant, care coordinator, nurse practitioner, registered nurse, the member, social worker, primary care, and other providers. Together, they create a plan that is specific for each member. These plans support healthcare and long-term care outcomes so members become as healthy and independent as possible. And the care team works with members to coordinate all covered health services. Partnership benefits include all Medicaid long-term care services, home and community-based waiver services, acute and primary, pharmacy services, and Medicare covered services, including Part D covered services. Care Wisconsin covered services include residential services, financial management, hearing and vision services, supportive home care, and pharmacy services. Benefits also include inpatient-outpatient hospital, primary and specialty physician services, and ancillary services. Pharmacy services are provided by Care Wisconsin's PBM, Envision Rx. If hospice is elected under the Medicare benefit, it and other services the member is receiving at the time hospice is being provided are first billed to Medicare. Home and community-based waiver-covered services covered under the Family Care Program, are subject to prior authorization through the member's care team. Contact Care Wisconsin's Customer Service Center for assistance in connecting with the care team at 1-800-963-0035. You must fax a prior authorization form and supporting documentation in order to obtain prior authorization for certain acute and primary covered services to Care Wisconsin. Acute and primary services that require prior authorization may include, but are not limited to, those on the following slide. Please go to carewisc.org/authorizations for the prior authorization forms, to obtain a complete list of prior authorization requirements, and outpatient procedures that do not require prior authorization. Some of the acute and primary services that require prior authorization under the partnership program may include, but are not limited to, are out-of-network services, except emergency care, hospitalizations, cardiac rehabilitation after the 8th visit, mental health and AODA visits, notification required following the 4th visit, mental health and AODA treatment, partial hospitalization, and intensive outpatient programs, non-emergent surgeries and procedures. See the list of outpatient procedures that do not require prior authorization on our website, genetic testing, MRI, PET scans, SPECT scans, CT scans, CTA scans, cardiac CT scans for calcium scoring. This is not an all-inclusive list of what requires prior authorizations or additional clarifications regarding the prior authorization requirements. Please go to the carewisc.org/authorizations for the prior authorization forms, to obtain a complete list of prior authorization requirements and outpatient procedures that do not require prior authorization. Understanding Medicaid SSI. Care Wisconsin's Medicaid SSI program was rolled out in 2014 and has grown to now serve residents in 30 Wisconsin counties. Care Wisconsin SSI members continue to use their Forward Health Card to receive services. Care Wisconsin does not provide their own Care Wisconsin ID card for Medicaid SSI members. We ask that you verify eligibility using the Forward Health portal before every encounter. Our toll-free number provides members access to our team of care coordinators and nurse care managers. This staff provides services which include a comprehensive telephonic care assessment and an individual care plan based on the needs identified through the assessment process. Part of this process includes identification and coordination with the primary care provider. The focus of the SSI Managed Care Program is about care coordination. The program goal is for all members to have established primary care. Not only is this mandated through the state, this will help to ensure that members have received necessary and coordinated health care. Many individuals enter the program with a designated primary care provider, and we will work with them and the provider to strengthen that relationship and coordinated care. Our care team staff will assist those members who do not have an established primary care relationship to identify an appropriate provider within our network. The Medicaid SSI benefits include most of the Medicaid state plan services, including inpatient, outpatient hospital, primary and specialty physician services, outpatient and inpatient mental health and AODA, and ancillary services. Care Wisconsin also pays for dental services for those Medicaid SSI members enrolled in Waukesha County. Care Wisconsin does not cover transportation, chiropractic, pharmacy services, and dental services for members outside of Waukesha County. Although Care Wisconsin does not cover these services, they may be available through other payer sources. For example, transportation can be arranged through MTM via the member's Forward Health card. You must fax a prior authorization form and supporting documentation in order to obtain prior authorization for certain covered services to Care Wisconsin at 608-210-4050. Services that require prior authorization may include, but are not limited to, those on the following slide. Please go to carewis.org/authorizations for the prior authorization forms, to obtain a complete list of prior authorization requirements, and outpatient procedures that do not require prior authorization. Some services that require prior authorization under the Medicaid SSI program may include, but are not limited to, are out-of-network services, except emergency care, hospitalizations, cardiac rehabilitation after the 8th visit, mental health and AODA visits, notification required following the 4th visit, mental health and AODA treatment, partial hospitalization and intensive outpatient programs, non-emergent surgeries and procedures. See the list of outpatient procedures that do not require prior authorization on our website, genetic testing, MRI, PET scans, SPECT scans, CT scans, CTA scans, cardiac CT scans for calcium scoring. This is not an all-inclusive list of what requires prior authorizations or additional clarifications regarding the prior authorization requirements. Please go to the carewisc.org/authorizations for the prior authorization forms, to obtain a complete list of prior authorization requirements and outpatient procedures that do not require prior authorization. Understanding Medicare Dual Advantage. Members' coverage must be verified before every encounter. Medicare Dual Advantage members are issued a Care Wisconsin ID card. Ask to see their Care Wisconsin member ID card and Forward Health ID card or other insurance card as applicable, and a photo ID. Check members' eligibility using the Forward Health online portal. Because members of the Care Wisconsin Medicare Dual Advantage program are also eligible to receive Medicaid benefits, Care Wisconsin encourages its providers to verify the member's Medicaid benefits and eligibility in the Forward Health portal on every encounter with the member. Members of the Medicare Dual Advantage program will be assigned a care coordinator who will assist and work with the member to create an individualized care plan. More specialized staff are available as needed, including an RN and mental health and AODA support. The RN will also work with members who are hospitalized as they prepare to transition back to the home or another setting as needed. Please note, family care members who enroll in Medicare Dual Advantage will remain with the care team assigned to them by Care Wisconsin under the Family Care Program. Medicare Dual Advantage benefits include all Medicare Parts A and B covered services and Part D covered services. Medicare Part A covered services include, but are not limited to, inpatient hospital care, skilled nursing facility care, and inpatient alcohol or substance abuse treatment. Medicare Part B covered services include, but are not limited to, outpatient services, durable medical equipment, home health services, outpatient mental health services, physician services, and preventive care services. Medicare Part A covered services are provided by Care Wisconsin's PBM and VisionRx. If a member elects his or her hospice benefit under original Medicare, then hospice and the other services the member is receiving must first be billed to original Medicare. You must fax a prior authorization form and supporting documentation in order to obtain prior authorization for certain Medicare-covered services to Care Wisconsin at 608-210-4050. Services that require a prior authorization may include, but are not limited to, those on the following slide. For members also covered under Family Care, all Family Care covered services must be authorized by the member's care team. Contact Care Wisconsin's Customer Service Center for assistance in connecting with the care team at 1-800-963-0035. Some services that require a prior authorization under Medicare Dual Advantage may include, but are not limited to, out-of-network services, except emergency care, hospitalizations, cardiac rehabilitation after the 8th visit, mental health and AODA visits, notification required following the 4th visit, mental health and AODA treatment, partial hospitalization and intensive outpatient programs, non-emergent surgeries and procedures. See the list of outpatient procedures that do not require prior authorization on our website, genetic testing, MRI, PET scans, SPECT scans, CT scans, CTA scans, cardiac CT scans for calcium scoring. This is not an all-inclusive list of what requires prior authorizations or additional clarifications regarding the prior authorization requirements. Please go to carewisc.org/authorizations for the prior authorization forms to obtain a complete list of prior authorization requirements and outpatient procedures that do not require prior authorization. Working with Care Wisconsin. All Care Wisconsin members have the right to receive timely access to medically necessary health care services. Care Wisconsin's Quality Improvement Committee approves member access standards and reviews network providers' compliance with the standards on an annual basis. Care Wisconsin members with life-threatening emergencies will have immediate access to care without prior authorization from Care Wisconsin. Members may receive emergency care from participating or out-of-network providers at hospitals within or outside of Care Wisconsin's service area. This care is available 24 hours a day, 7 days a week. Care Wisconsin has established the following standards for timely access to care. 30 days for an appointment with a primary care provider. 30 days for a follow-up appointment with a mental health provider after an inpatient mental health stay. 90 days for an appointment with a dental provider for routine dental care. 2 weeks for medically necessary high-risk prenatal care. Wait time at care facilities is not to exceed 30 minutes. Physicians and behavioral health providers must ensure there is a system in place for providing after-hours accessibility and must inform members how to access care after hours. After-hours calls should be returned within 1 hour. Physicians on call for network primary care providers and specialist providers are subject to Care Wisconsin's access standards. All providers are required to provide members with an emergency telephone number for use after regular office hours. Members should also be provided with a written summary about how to access care after hours. Care Wisconsin is committed to continuously improving processes to enhance outcomes for members. Clinical and service quality is measured, evaluated, and monitored through the following programs: Healthcare Effectiveness Data and Information Set, or HEDIS, Consumer Assessment of Healthcare Providers and System Survey, or COPS, CMS STARS, Health Outcome Survey, HOS data, and other quality measures. Care Wisconsin's partnership program and Medicare Dual Advantage are special needs plans. CMS requires special needs plans, or SNPs, to have models of care which outline how the plan will provide care to meet the specialized needs of the enrollees. The model of care requires us to have an appropriate network of providers and specialists, conduct an initial assessment and an annual reassessment of the individual physical, psychosocial, and functional needs of each enrolled individual, develop a care plan that identifies goals and objectives for that individual, and have a comprehensive quality improvement plan. The Care Wisconsin model of care also uses the interdisciplinary team in the management and coordination of the member's care and works with the physicians, other providers, and the member to coordinate care, including patient-family education, self-management of chronic disease, preventative care, and discharge planning. The exchange of information between the provider, Care Wisconsin, and the member is critical. Care Wisconsin follows the CMS guidelines to deliver the appropriate educational pieces to its provider network. For our model of care training module that outlines the role of contracted providers in delivering care to our special needs plans for partnership or Medicare Dual Advantage members, please go to the following website, www.carewisc.org/providers/training. Healthcare fraud, waste, and abuse are estimated to account for between 3 and 10% of annual expenditures for healthcare in the United States. Healthcare fraud is both a state and federal offense. Based on HIPAA regulations of 1996, a dishonest provider or member may be subject to fines or imprisonment of not more than 10 years or both. Care Wisconsin is committed to preventing fraud, waste, and abuse by members, providers, and employees. CMS requires the completion of fraud, waste, and abuse training by Care Wisconsin network providers on an annual basis. Fraud, waste, and abuse training is available at the website at the bottom of the screen. Examples of fraud, waste, and abuse by members are overutilization of emergency room services, oversupplying of controlled substances, prescriptions or DME, doctor shopping, pharmacy shopping, inappropriate medication combinations, prescription forgeries, and member card loaning or sharing. Provider fraud, waste, and abuse examples are billing for services not provided, billing for the same service more than once, and performing inappropriate or unnecessary services. We encourage you to report suspected fraud and abuse and questionable and illegal activities to Care Wisconsin. For Care Wisconsin's compliance hotline, you can call 1-800-963-0035, extension 3576. Always notify Care Wisconsin about the following changes: change of address, change of tax ID number, change of providers in a group practice, new sites or closed sites, change in practice name or ownership, or a provider who goes on an extended leave of absence. To report changes to provider services, you can complete forms available online at www.carewisc.org/providers, by fax at 1-608-245-3844, by email pscs@carewisc.org, or in writing to Care Wisconsin, Provider Services, P.O. Box 14017, Madison, Wisconsin 53708-0017. Visit carewisc.org to access information 24/7. There you can find our provider manuals, claim information, prior authorization forms and reference documents, provider newsletters, and provider directory search. You can also find critical training for you and your staff, such as fraud, waste, and abuse, model of care, and system training. The website also contains additional and up-to-date information on Care Wisconsin's programs and news about our organization. Here's a list of contact information for your organization. It also can be found in our provider manuals on our website at www.carewisc.org Provider Manual and Policies. Provider claims. Please note, see program benefit information to know which benefits are covered by and billable to Care Wisconsin per each program. For acute and primary covered services and Medicare covered services under Medicare Dual Advantage, submit claims to Care Wisconsin via paper or electronically within the timely filing limit specified in your contract. Please allow up to 30 days from claim submission date to receive payment. For Family Care and Medicaid SSI members eligible for Medicare who do not enroll in Care Wisconsin Medicare Dual Advantage, submit Medicare covered services to the member's primary Medicare plan first. For Family Care and Medicaid SSI members also covered under Care Wisconsin Medicare Dual Advantage, we will process both primary and secondary Medicare and Medicaid covered claims. A provider does not need to resubmit to Care Wisconsin for secondary Medicaid covered services. However, for Medicare eligible members who have elected the Medicare hospice benefit, you must submit all covered services first to Original Medicare. We accept standard electronic billing for professional and institutional. That would be the 837P professional or 837I institutional as appropriate through MDON with a payer ID of 27004. We also accept the paper standard claim form, CMS TICFA 1500 or CMS 1450 UB as appropriate. The paper claims address is below. We do not accept any claims by fax. Please see the program benefit information to know which benefits are covered by and billable to Care Wisconsin. For long-term care covered services, submit claims to Care Wisconsin via paper or electronically within timely filing limits specified in your contract. Please allow up to 30 days from the claim submission date to receive your payment. For the Family Care and Medicaid SSI members covered by Medicare, submit any covered services first to Medicare. For long-term care services, Care Wisconsin has our own paper claim form that you can use for certain services. We have a residential claim form, which you would use for room and board and care supervision services if you are a residential facility. We have a general services claim form, which you would use for services such as supportive home care, pre-vocational, meals, transportation, etc. We also accept standard claim forms for things like skilled nursing facilities, mental health, DME, DMS, personal care, etc. And those again would be on the CMS 1500 or UB forms as appropriate. The paper claims address is below. Again, we do not accept claims by fax, mail only. For the long-term care services, we also offer claims web portal. The portal is only for providers who currently bill on the Care Wisconsin claims forms, general or residential. If you are one of these providers, you have the option to bill electronically using the claims web portal. You can also use the site to view electronic remittance, verify eligibility, and check claim status. To sign up and for instructions, please go to our website at carewisc.org/providers/claims. If you disagree with a claim payment determination, you have the right to appeal. You must submit an appeal within 60 calendar days of the initial denial or partial payment to Care Wisconsin in writing, clearly marked appeal. Include a thorough explanation for the basis of the appeal and all pertinent information. Submit the appeal to the address indicated on the slide. An appeal form is also available for your convenience on our website at carewisc.org/providers/claims. Providers play a significant role in helping Care Wisconsin enact its mission to promote the quality of life of our communities by empowering others and working together to creatively solve unique health and long-term care needs. On behalf of the management and staff of Care Wisconsin, we would like to take this opportunity to welcome you to our quality network of physicians, hospitals, and long-term care providers.